Have you ever felt a sudden, overwhelming wave of terror? I mean, your heart is pounding, you can't seem to catch your breath, and you feel like you're completely losing control. That's a panic attack. It's something that millions of people experience, but it's pretty misunderstood. So in this explainer, we're going to demystify it. We're going to break down what's really happening inside your mind and body.
So what are we really talking about here? Well, the official definition calls it a sudden surge of intense fear. And let's just pause on those words for a second. Sudden, surge, peak within minutes. This isn't just a slow buildup of anxiety, right? This is a tidal wave of terror that feels like it comes out of absolutely nowhere. And that feeling is exactly what we're going to explore. And that leads to a really important question. Have you ever felt that intense fear? That surge of panic when there's no good reason for it? You look around and everything is fine. You're perfectly safe, but your body is just screaming at you that you're in terrible danger. If any of that sounds familiar, you're definitely in the right place. So, what is a panic attack at its very core? Honestly, the best way to think about it is as a false alarm. Just imagine your body has this amazing built-in fire alarm system. It's designed to protect you from real danger. But during a panic attack, that alarm is blaring at full volume, and there's no fire. And this is where the difference becomes so important. Normal fear, that's your response to a real threat, like, say, hitting some crazy turbulence on a plane. It's scary, for sure, but it makes sense. A panic attack is that exact same level of terror, but the trigger is inside you. You could be sitting calmly at home, and all of a sudden your body is reacting like you're in mortal peril. It's that disconnect that makes it so incredibly terrifying. And because that internal alarm is so powerful and so convincing, the experience feels completely real. I mean, the physical feelings are so intense that people often rush to the emergency room absolutely convinced they're having a heart attack or that they're dying. And it's so important to understand this is not an overreaction. It's a direct result of just how powerful the symptoms really are. Okay, so what are those powerful symptoms? What does this false alarm actually feel like when you're in the middle of it? Let's break down what's going on in both your mind and your body. First, let's talk about the big physical ones. Your heart starts pounding, right? Maybe it feels like it's racing out of your chest. You might break out into a cold sweat. Your breathing gets really shallow, and it can feel like you're choking or just can't get enough air. And for a lot of people, there's this intense chest pain or a wave of sickness in your stomach. It's pretty easy to see why these things get mistaken for a heart attack. But that's only part of the story. You might also feel these really strange waves of chills or heat flashes, or numbness and tingling in your hands and feet. You might feel super dizzy, like you're about to faint. And then there's the really weird mental stuff, this profound feeling of being detached, almost like you're watching yourself in a movie, or like the world around you suddenly isn't real anymore. Okay, we absolutely have to pause here because this is so important. While these are all classic symptoms of a panic attack, they can also be signs of a real medical emergency. The bottom line is simple. If you are ever in doubt, especially if you have chest pain or you're struggling to breathe, do not try to diagnose yourself. Call for emergency help right away. All right, so we've covered the what, but the biggest question for most people is why? Why on earth does the body's alarm system just go off like that for no reason? Let's take a look at what some of the potential causes might be. Well, there's not really one simple answer. One idea is that it's the mind trying and failing to push down anxious thoughts. Another is that some tiny little physical feeling or a random thought gets magnified, just blown way out of proportion into a full-blown alarm. But here's what's so crucial to get. Sometimes there is no trigger at all. The attack can be completely spontaneous, which is a huge part of what makes it so random and so scary. Now, just understanding what's going on is a huge step forward. But here's the most empowering part. Panic attacks are highly treatable. You are not powerless here. So let's turn to the different ways to find relief. When it comes to medication, there are basically two main paths. On one side, you have things called benzodiazepines. These work super fast, almost immediately, to stop an attack right in its tracks. But they can come with a risk of dependence if used long-term. Then on the other side, you have SSRIs. You take these every day, and over a few weeks, they work to make the attacks happen less often and feel less intense when they do. But medication isn't the only option. Psychotherapy is an extremely effective treatment, especially a type you might have heard of called cognitive and behavioral therapy, or CBT.
So, how does something like CBT actually work? It's not just about talking, it's really about doing. It helps you pinpoint and then challenge the specific thought patterns that are fueling the panic. The goal is to change your relationship with those scary physical symptoms, and, most importantly, to build a set of long lasting coping skills. It's all about putting you back in the driver's seat, not the fear. 20 minutes. Now, I know it can feel like an absolute eternity when you're in it, but that's what the research shows. 20 minutes is often the typical length for the most intense peak phase of a panic attack.
But the whole experience can definitely linger. And the real danger, if you don't get help, isn't just the attack itself. It's the fear of having another one. That fear can start to take over your life, leading to other really serious issues like depression or phobias. And that's exactly why reaching out for support is so important. Okay, this brings us to one last really crucial thing we need to clear up. Having a panic attack is not the same thing as having panic disorder. Let's quickly talk about the difference. So, the first part of the puzzle for a panic disorder diagnosis is that the attacks keep happening and they're unexpected. This means it's not just a one-time thing, but a pattern that's developed. But even that isn't the whole story. You see, for it to be a disorder, there has to be a second piece. The person either develops this constant, intense worry about having another attack, or they start to seriously change their life and their behaviors to avoid anything they think might trigger one. So the disorder isn't just about the attacks themselves, it's about living in constant fear of the fear. So as we wrap things up here, let's just come back to the main point. A panic attack is a deeply, deeply frightening experience. No one is denying that. But it's not some mysterious, unbeatable force. It's an understandable event happening in your body and your brain. And most importantly, it is highly treatable. Just understanding what's happening, that is the first and maybe the most powerful step you can take to strip away the fear of the unknown. So the final question isn't for me, it's for you. Now that you have this understanding,